Hello everyone, good evening to all of you. How are you all? Good evening, bacha log. How are you all? Good evening, Vijay. Okay, Akshara, Akshar, Akshara. Yes, Akshara. Good evening, Akshara. Okay, how are you guys? Good night, Mr. Bean. Bye bye. Goodbye. Tata. Bye bye. Gaya. Good night, sir. Fine. Good morning, B Pharma. Happy New Year. Merry Christmas. Happy birthday to all of you. Happy birthday to all of you. Alright guys, so NIPER JEE Marathon is start from today onwards, and we do have a lots of MCQs for that, right? Every day, every single day, you will be having 50 sets of MCQs every day with different topics and from different subjects as well. Not only pharmacology, with every aspects of the pharma you will be covering, like, okay, it's night, sir, evening, so good evening. That's a simple logic, no, Mr. Bean, right? Not only pharma but also the non-pharma as well will be taken for you guys, okay? So you don't have to worry about that much, and we'll be doing this marathon continuously onto the basis, right? So how many of you know about the NIPER JEE, right? How many of you know about the NIPER JEE, that how much शेड्यूल पीएफ कहाँ मिलेगा? मैं इसके नीचे पढ़वा दूंगा, डोंट वरी, ठीक है? मैं पीडीएफ यहाँ पे नीचे मैं पढ़वा दूंगा, ओके? सो हाउ मेनी ऑफ यू नो अबाउट द नाइपर जेई गाइस? गुड नाइट, बाय बाय मिस्टर बीन. It's not a meme, as your name suggests, Mr. Bean memes. It's not a meme right now, right? How many of you? So what do you know about the NIPER JEE, guys? What do you know about NIPER JEE? What do you know about the NIPER JEE examinations? Guys, tell me something about NIPER JEE. What is NIPER JEE? Now, why do we have to give that? Why do we have to give that one? Huh? Why do we have to give that one? What's the advantages of that one? Yeah. So why in Hindi marathon series 8,000 question, English only 5,000? क्या ही बताऊं मैम, शिवानी आनंद. I can't say anything on this matter. Just steering the class with positive vibe and humor, sir. That's it. I know that. I know. For getting admitted into the NIPER admin institutes, obviously. And how many NIPER we do have? How many NIPER we do have? We do have 7 NIPERs, right? NIPER Mohali, NIPER Hyderabad, NIPER Ahmedabad, NIPER Raebareli, NIPER Guwahati, and NIPER Hajipur, NIPER Kolkata as well, right? So these are 7 NIPERs. 3 more NIPERs are yet to come, but it will take some time to open, right? And how many of you want to go in NIPER Mohali, NIPER Hyderabad, the top NIPERs? How many of you have want to get the admission to join into the India's most reputed institute in pharma sector? That's right, Mr. B. That's right, Hannah. So, how many of you wants to join NIPER Mohali, NIPER Hyderabad, Ahmedabad, Raebareli, Guwahati? How many of you want that one? Hyderabad, okay. Shivani Anand says Hyderabad, okay. And Acha, write it down. Which NIPER you want? Which NIPER you want, guys? Which NIPER you want? That's what I'm saying. Hyderabad. Okay, Hyderabad, and and Hyderabad. Everybody wants Hyderabad. I am already from नाइपर हैदराबाद. क्या बात है? पीएचडी की तैयारी कर रहे हो क्या, मिस्टर बीन? Are you preparing for the PhD? Hmm? Or is it a meme? No, it shouldn't be a meme, no? Why you will be saying this as a meme? Hyderabad or Mohali? Okay. Then and and guys, tell me what's your dream college? In which college you want to pursue your masters or PhD? Yeah? I came here from future. क्या बात है जिंगला लहू Okay, Hyderabad. Vilasini says Hyderabad. Okay, chalo. Fine, guys. Chalo. I wish you get whatever you want to, whatever college you want as your dream college. I wish you get that. I wish you get that. Right? So manifestation is real, guys. Hana? Manifestation is. That's what I'm saying, Mr. Bean. Yes, manifestation is real. Right, whatever you think, if you think about that one, you will definitely going to get that one, right? That's what I always say to my students. Manifestation is real. When you manifest, when you think about that one regularly say, I want to be in that damn college in next year. I want to play Holi there. I want to celebrate Diwali there. I want to celebrate my favorite festival over there, right? I want my culture to be celebrated in that Mohali, NIPER Mohali. I want my culture to be celebrated in Hyderabad, right? So manifestation is damn real, right? And that's what you should always do, right? Right? Are we good to go, guys? है ना? So, uh, उससे पहले, before that, we have to learn something about the NIPER, है ना? NIPER JEE questions, right? NIPER JEE paper pattern, right? NIPER JEE, अरे यार, paper pattern, right? So what's the paper pattern? That's your pharma. Pharma is what? Pharma is around 160 questions, right? And non-pharma is around 40 questions. And you have 2 hours for that. 2 hours for that, right? 0.5 for positive and 0.125 for negative, right? This is the marking scheme. 2 hours. 0.5, 0.125, that's for negative, right? Good evening, Shravani. Good evening. Okay, so this is the marking for that. Hana, 2 hours only, 160 questions and 40 questions. That's what I'm saying. But as compared to the GPAT, they won't ask you about the assertion and reasoning based questions. Hana, assertion and reason based question. They won't ask you statement based questions. Yeah, they may ask, but the quantity of those questions will be less as compared to the GPAT questions, right? Although you'll be seeing direct based questions, right? Either you can able to attempt that one within 10 to 15 seconds maybe, right? So those are the questions. Accuracy is hell important in this one. Accuracy is hell important because you want ultimately rank. You want rank, right? Out of 6 to 7,000 students who would be qualifying the GPAT examination, you will be having around 1,000 seats in the NIPER. 1,000 seats into the NIPER, and that is also being distributed according to your caste as well, your category as well, right? So that is what important you have to mention. That is what the accuracy. Accuracy is hell important in every kind of the thing, right? Clear? Shall I start? Huh, guys? Shall I start? Shall we start? Only nine people are over here, and millions of the students would be in the Hindi. Fine, no worries. No complaints, no demands. Whatever I'm getting by your love and your interest, right? And I hope it continues and it grows specifically, right? Chalo, clear? Okay, guys. Fine. No A and R type questions and find correct or wrong except kind of questions. Yeah, they can ask correct or wrong except kind of question. Yeah, they can ask like that one. Okay, chalo guys, let's start with this one. Okay. Now, name of a drug accepted by a scientific body. USAN, United States Adapted Name Council is it going to be the generic name? Is it going to be the chemical name, proprietary name, or brand name? Chalo guys, can you tell me this one? Can you tell me this one, guys? Yeah? Anyone? Anyone, guys? Anyone? That is going to be your generic name, right? And generic name is also known as your non-proprietary name, right? Non-proprietary name. It is also known as the approved name, right? It is also known as the official name, right? Simple. Chemical name is the chemical name, parent key chain name. That is what. And a proprietary name is also known as your brand name, also known as your trade name, right? And now listen to my story very carefully. And Aksar, most of the time they do ask about this one, this keyword, non-proprietary or proprietary, right? They will confuse you from this. They will confuse you from this. That's your non-proprietary or proprietary. Generic name, schedule W. क्या बात है? Very good, Shravani. Very good, right? चलो, है ना? So, what is that one? Proprietary. Consider proprietary as your property. Consider proprietary as your property, right? So, property which you own, right? Which you own. And which you own, you want to make it the brand, right? You want to make it big, right? You want to make it big. And big, that is brand, right? And after some time, if you get retirement, whatever you kind of a thing, now you want to see, ki, acha, I am getting my retirement. Now it should be traded. It should be traded, right? So proprietary brand, it he makes a big brand. Now he's going to trade that. Simple, simple. Now what happens? If you can say non-proprietary, non-property, I have not that property. Yeah, it should be approved or official or generic. Generic means that is open to all. Generic means open to all. Simple. Generic means open to all. Non-proprietary, approved, official, or open to all. So if it is open to all, then it should be approved, right? And if it is approved, it should be official, right? Whatever is open to all, it should be approved first, no? And if it is approved by someone, so that will be a official, right? And approved, official, open to all, everybody has that, so it is a not a property of someone. It is not a property of someone. Is it clear? Simple? Give me a thumbs up if it is simple. Proprietary names belongs to schedule V, patent proprietary. Very good, Shravani. Very good. Yes? Simple? Say simple if you get that one. Say simple if you get that one. Huh, guys? Chalo. Very good, very good, very good, very good. So now you won't hesitate to learn this one, right? They may ask question from here. And this one, United States adaptive name in associated with generic. That is important, right? That is important. Okay. Now, and for the generic name, and for the generic one, you will be filing abbreviated new drug application, right? You will be filing abbreviated new drug application into the clinical trials after phase 3. Yes, after phase 3, you will be filing ANDA, not INDA, not NDA. NDA is filed for the new drug application after phase third. After phase third, right? IND is filed after preclinical trial. After preclinical trial, that is going to be filed, right? Chalo. Now, next question. So yeah, that's what I was talking about. Approved name, non-proprietary. It is not a property for someone, so it is approved, right? Official and generic name, right? For example, phenytoin. Phenytoin is a generic name. Aspirin is a generic name, right? Sir, is there any free mock test for this NIPER exam? Uh, we'll let you know by the time, guys. है ना? अभी we have not decided that one, but it will be coming surely. Okay, so don't worry about that one. Give me a day or two, I will definitely come with that solution for you guys. Okay. Chalo. Brand, proprietary, or you can say trade, right? Trade. So dilantin, है ना? Dispirin, right? Dolo. That is what the brand name. Chemical name is diphenylhydantoin. Hydantoin structure is present in the phenytoin, right? Code name is specifically for the clinical trial, guys. This is important. है ना? Code name is specifically given for the clinical trial, right? Chalo. Am I explaining bad, guys? Explanation. I'm explaining bad. Huh? People are left. People going to left. So when NIPER examination, hopefully in May or June only, right? Hopefully in May or June only. Chalo. Majority of drug passes biological membranes by. I will let you know. 𝙂𝙂 DJ. Will let you know. Chalo. Passive diffusion, active transport, pinocytosis, or facilitated diffusion. Chalo. I don't know what's happening over here. You know? Fine, whatever it is. Majority of drug passes biological membranes primarily by Isa DJ. I will let you know. Don't worry. Passive diffusion? Yes, passive diffusion is the most common method. Yeah, through which the drug passes through primarily, right? So it follows zero order, first order. It follow. No, sir, you are spending more time on simple question. That's what I do, Mr. Bean, right? And that's what I do, and that's what should be doing, right? And if you want to, just solve this one, then this is not a thing for you, Mr. Bean. है My simple target, ke I should recall all the things and make the things easy for you. That was the first thing. So passive diffusion is your first order, right? Also known as the non-ionic, non-ionic transport, right? Also follows the first order kinetics, also following the fix first law. Also following the fix first law of diffusion, right? Fix first law of diffusion against the concentration gradient or with gradient. Let it be, Mr. Bean. Ana. I won't have that much to talk about this much Ana, onto this one, right? Passive diffusion, it would be conceptual for you, Hana. It would be easy for you, but it may not be easy for other ones. Hana. Anything can happen with that. Hana. I'm not specifically coming here for some people only. I am coming for everyone over here, right? So passive diffusion with the concentration gradient, right? With the concentration gradient. So it is be dq by dt is equals to 𝙈𝑎𝑘𝑂 by W 𝐶𝑔𝑖𝑡 minus C upon H. This is the fixed first law. Okay. dq by dt is the rate of diffusion, right? D is the diffusion constant. A is what the surface area. Ko by W, that's your partition coefficient. And Cgit minus C is going to be the concentration gradient. And H is your thickness. Alright. Active transport and Pinot transport, they both apply. They both want the ATP, right? Pinocytosis. And pinocytosis is also known to be as the cell drinking, right? Cell drinking. Simple. Cell drinking. Facilitated diffusion, they require some facilitation, right? For example, the enzymes, transporters, carriers, right? Those kind of things. Now, okay. Now, which is not obtained from animal? Heparin, captopril, erythromycin, or primarin? Simple. Simple, guys. Simple. Chalo. This one. Which is not obtained from animal? Heparin, captopril, erythromycin, or primarin? Don't take it personal and serious, sir. I just shared a suggestion, sir. No vengeance on you, sir. I also okay with it, sir. I just predicted the reason why they left. Fine, no worries. No worries. Let them left. No, why? Chalo, fine. Whatever it is. Now, heparin, captopril, erythromycin, or primarin. That's your That's your captopril for sure. That is your ACE inhibitor, right? ACE inhibitor. And ACE inhibitor are what? These are going to inhibit the ACE enzyme, which is responsible for the conversion of. Can you guys tell me? ACE inhibitor is inhibiting the ACE enzyme, but ACE enzyme is responsible for the conversion of angiotensin 1 to angiotensin 2, right? Angiotensin 2. And ACE is coming from the lungs. That is important. ACE is an enzyme which coming from the lungs, right? Chalo. Captopril is one of the drug which is known to be as the shortest acting drug. Shortest acting ACE inhibitor. Shortest acting ACE inhibitor, and also it is having the sulfhydryl group. Sulfhydryl group. Sulfhydryl group. Okay, Premarin is just a type of the heparin kind of a thing. So can you please take class daily? I can't. I can't because this is the NIPER Marathon, no? So every teacher has to take that one. Okay, chalo. Now, which of the following receptor ligand gated pathway is correct? Following receptor ligand gated pathway. Okay, insulin receptor ligand pathway is correct. Insulin G protein receptor, mineralocorticoid tyrosine kinase, vitamin K intracellular, adrenaline, ligand gated ion channel. Chalo. Insulin acting on GPCR, mineralocorticoid tyrosine, vitamin D intracellular receptor, adrenaline or ligand gated channel. Anyone? Angiotensin 1 to angiotensin 2. That's right. Very good. Chalo, this one, guys, is incorrect. Is correct, sorry. Is correct, right? Is correct. So, which is one? Insulin to G protein coupled receptor, mineralocorticoid to tyrosine, vitamin D to intracellular, or adrenaline to ligand gated. Yeah? Anyone? That's your C, guys. C, 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 C. Right? Vitamin D is going to act on the intracellular receptor, right? Chalo, fine. Now, here you goes. This table is important. This table is important. Tyrosine kinase receptor, insulin, cytokinin receptor, growth factor. These are your tyrosine kinase. Nuclear receptor, vitamin D, and that's why it is known to be as an intracellular. Why? Because it is present inside the cell, right? Mineralocorticoid, steroid hormone. Simple. Good evening, Navneethan. Navneethan. Okay, welcome back. GPCR, adrenergic receptor, adrenaline, right? Ligand gated, nicotinic, as well as the GABA receptors. GABA A receptor to be precise, right? Not GABA B. GABA A receptor only. GABA B is your GI mediated. Okay, now this one. Counterfeit drug is fake medicines, right active ingredient but wrong dose, also called the dummy medication, or all of these. Which one is it? Which one is it, guys? Fake medicines, right active drug but wrong dose, also called as the dummy medication, or all of these. Which one is it? Counterfeit drugs. Huh? Simple. Mr. Bean says D. Yeah, that's right. That's right. That's right. And all of these is going to be the correct answer. It can be fake medicines. It can be right active drug but wrong decision, also called as the dummy medication, which thing is also known as the whole general pharmacology only. General pharmacology only. Okay. Chalo. Now, which thing is also known as the dummy medication, guys? That's what I'm asking. Which thing is also known to be as the dummy medication? Anyone? Which thing is also known to be as the dummy medications? Placebo. Very good. Placebo. Placebo. Inert substance, right? Inert substance. Very good. Placebo. Chalo. Fine, fine. Chalo. Which of the following is a type of parenteral route used for the drug administration? Okay, parenteral. Very good, Shravani. Intra-articular, intrathecal, subcutaneous, or sublingual? Which one is a parenteral route of the drug administration? Parenteral route. Anyone? Psychopharmacology. Very good, Mr. B. Yes, that is going to be the C. Very nice, very nice. Intra-articular. Intra-articular directly into the joints, right? Directly into the joints. Intrathecal onto the spinal cord. Onto the spinal cord. Sublingual, that's not your parenteral one, that oral drug, oral route. है ना, but bypass the first pass metabolism, bypass the first pass metabolism, right? Intrathecal spinal cord, subcutaneous, right? And which angle do we have the subcutaneous, guys? Can anyone tell me which angle do we have in the subcutaneous? Which angle? Anyone? Which angle do we have into the subcutaneous? That's not 15. That's not 15. IM is 90. Everybody knows that one, right? Subcutaneous is 45, right? IV is 25 and ID is 10 to 15 degree, right? 10 to 15 degree. Okay? Chalo, chalo. Very good. 45, 45. Very good. Very good. Now. A highly ionized drug. Okay, highly ionized drug is excreted by the kidney, can cross the placental barrier easily, is well absorbed from the intestine, accumulates into the cellular lipids. Which one is it? Very simple. Very simple, right? Is that so? Right? Very simple question, no? Yeah, very good, Ishwarya, है ना? चलो, IM 90, subcutaneous 45, IV 25, dermal 10 to 15. Very good, Shravani. है ना? तो highly ionized drug. Ionized drug means it is a polar one, right? It is a polar one. It should be hydrophilic, right? And if it is hydrophilic, so it is mainly excreted by kidney. Simple, right? It is mainly excreted by the kidney. Placental barrier? No, it should be lipid soluble. It should be lipid soluble. That's your hydrophilic, right? No, no, it cannot cross the placental barrier. It should be well absorbed from the kidney. It should be lipid soluble again. It should be lipid soluble again. Cellular lipids, lipids. Again, lipid solubility is requirement. Lipid solubility is requirement. So obviously it's going to be A only, right? A highly ionized drug, right? Chalo. Okay, which is not a prodrug. Which is not a prodrug. Enalapril, lisinopril, perindopril, or ramipril. Chalo. Which one is it? Enalapril, lisinopril, perindopril, or ramipril? Which one is it? My internet is very slow, sir. So I use sir slowly. Nahi samjha. I didn't get that one. Akash, what are you trying to say? I'm not getting. Okay, that is what? Enalapril, lisinopril, or perindopril, or ramipril. Which one is it, guys? Anyone? C says histamine. Okay. What's that name? 𝘂𝙂𝙎𝘾𝙐𝙎. Lisinopril, okay. A. Enalapril. B. Shravani says. Ganesh Parimar Shivam says B. Yeah, that's right. Lisinopril as well as the captopril, right? These are the one which is not a prodrug. Hey, hey, captain, captain, listen, listen. You are not a pro. You are not a pro. This is the trick to remember, guys. 50 only, 50 only. Rangu. Shravani. Okay, Shravani. Rangu, Shravani. Hey, captain, listen, you are not a pro, right? Hana, so if the captain gets old, then one of a team member tells to a captain, hey, captain, listen to me very carefully because you are not a pro anymore, right? Hey, captain means captopril, and listen means lisinopril. These are your not pro, so these are not the pro one. Okay, Shravani doing very good. Shravani, you are doing very good. Every question you have done right today. That's good to see. Chalo, very good, guys. Okay. Now, type 3 hypersensitivity is primarily mediated by IgE bound to mast cells, sensitized T lymphocytes, antigen antibody complex involving IgG auto antibodies against cell surface receptors. Which one is it, guys? Chalo, simple. Yeah, anyone. IgE bound to mast cells, type 3 hypersensitivity, sensitized T lymphocytes, antigen antibody complex involving GG, autoantibodies against cell surface receptors. B started reversion, sir, by or that's glad to know, Shravani. Hana, Vijay C say C. Okay, B who said? Navinathan sees B. B. Okay. Akash says B. Vijay says C. Okay, C. Shivani Anand says C. Ishwar Arya says C. Ishwar Arya, are you the same person who texted me into the LinkedIn? Ishwar Arya. Yeah? Is it you? Yeah, that is going to be very right. Antigen antibody complex with the involving IgG, that is 100% right. IgE bound to the mast cells, that is what? Type 1 hypersensitivity reaction. Type 1 hypersensitivity reaction. Sensitized T lymphocyte, that is your T, so that is delayed, T, right? Delayed, right? Antigen antibody, IgG, yes, that's right. That's your type 3 antibody, right? Ishwararya, okay, Ishwararya, welcome. Auto antibodies against cell surface or receptors? No, that's not the thing to remember. Okay, now here you have the thing. Okay, apart from that, can I tell you something more? Can I tell you something more? Yeah, I can. So, ah, yes, so IgE, that is, since it is known to be as the type 1 hypersensitivity reaction, so it is known to be as the anaphylactic reaction, right? Anaphylactic reaction. One for A. A comes at first position, right? Sir, explain ABCD types. That's what I'm doing. That's what I'm doing. So here you can see. Hey, type 1, type 1, anaphylactic shock, right? Sensitized T lymphocyte, that's your delayed. Delayed is your type 4, right? Type 4 sensitivity reaction. Now, that is what the cell mediated, right? Antigen antibody type 3, type 3. That is antigen antibody complex. C comes at third position. C comes at third composition involving IgG. Autoantibodies, no. And there is another one. There is another one known to be as type 2. Type 2, which is known to be as a cytolytic reaction, which is known to be as the cytolytic reaction. And if you see this one, 2, right? 2 means two antibodies. Two antibodies, that's your IgG as well as the IgM, right? IgG as well as IgM. That is going to do what? That is going to do have a correlation with type 2 cytolytic reaction. Simple. Okay, type 1, type 2, and type 3, these are the humoral, in which you will be seeing the IgG antibody, IgM antibody, IgE antibody, right? Anaphylactic mein IgE antibody, right? But in type 4, type 4, that's your delayed cell mediated. It is not a humoral one, okay? This is what the difference. Easy, simple, right? Simple or easy, if you get it. If you get that one, right? Simple or easy. Why there is no NIPER English batch, only a Hindi are there? It is there. It is there, Vijay. We'll let you know. We'll let you know. Hana, text me once, we'll let you know. Okay, simple, yes? Simple, easy. Very good. Now, tachyphylaxis. Tachyphylaxis is an effect in which dependence occur, rapid tolerance occur, rapid dependence occur, tolerance and dependence occur. Chalo, simple. Simple, guys, simple. Mr. Bean, where are you from, by the way? That's what I ask to every student of mine. And Mr. Bean, where are you from, by the way? From Andhra only or somewhere else? Okay. Also called Arthur's reaction is type 2. Very good, Shravani. Arthur's reaction is a type of the chemical type of the reaction in type 3. Very good. Hana, tachyphylaxis, tachy means rapid, right? And phylaxis means the tolerance. So rapid tolerance occur, that is going to be the B answer, right? Chalo. Now, psychological dependence is also known as drug tolerance, drug addiction, drug synergism, or drug antagonism. Bacha knows. है ना? Even a small kid knows this one. Psychological. How can I live without her? Hmm. She is everything to me. Hmm. Yeah, that's what the thing is, right? I have done everything what I capable of for her. Hmm. I tried everything to make her happy. That is what the psychological thing. That's your drug addiction, right? Okay. So very good. Okay. Now this is what drug addiction, and here you have the amphetamine, right? Amphetamine, cocaine, cannabis, lysergic acid derivative. These are what? Don't feel. I'm not trying to feel that one. I'm trying to make you feel that thing. Okay, so that you can pick the right answer, Vijay. Okay, so this is going to be the thing. Okay, chalo. Now, measurement of inulin. Renal clearance is a measure of. Okay, inulin. Renal clearance is a measure of effective renal blood flow, effective active renal secretion, renal drug excretion rate, glomerular filtration rate. Easy, guys. Easy, easy, easy. Yeah. Anyone? Apart from inulin, there is a creatinine as well, right? Creatinine as well. That's why we used to see when KFT is done, kidney function test is done, and we used to see creatinine levels, right? How much is creatinine level? That is what the creatinine is, usually the glomerular filtration rate, right? Creatinine is the end product of the muscle and end product end product of muscle metabolism, right? Muscle metabolism, right? That's what a thing is, right? Creatinine is what? End product of muscle metabolism. That is hell important, guys. Okay, tell me. See this one. Inulin is a homopolysaccharide. Inulin is your homopolysaccharide. Okay, this is you have to remember. So, now, which drug can cause the pre-closure of ductus arteriosus in the fetus? Okay, now comes with the adverse drug reaction. Okay, pre-closure of the ductus arteriosus in the fetus. That's what I told you. Hana, if you are my prime batch student, a ranker batch student, crash course student, you will definitely able to answer this one. You will be definitely able to answer this one, guys. So, I have given you a trick also over there. If you remember, what should be the correct answer? What should be the correct answer? Shravani says I-A. Very good. Very good. Anna, that's what I wanted to see. Anna, that's your I-A. Sir, 140 marks OBC. Should I prepare for NIPER or GPAT? Huh? Should I prepare for NIPER or GPAT? GPAT is to done. Okay, next year GPAT. Wait for some time. What should I say? Right? 140 is your OBC. I can say like borderline, right? Borderline. You can go through, or you can uh, that's the thing that I will be fear of to say, right? So do wait for some time. Yeah, that's a borderline, 0 to 1. Okay, chalo. That's your IIA is your endomethacin, ibuprofen, as well as the aspirin, right? These are the ones which close the ductus arteriosus, right? Endomethacin, right? And which are the one which opens the ductus arteriosus? Can anyone tell me? Opens the ductus arteriosus, keeps the patent ductus arteriosus, keeps the patency of ductus arteriosus. Ductus arteriosus. Can anyone tell me that one? Right? Anyone? Opens the ductus arteriosus? Anyone? Yeah? Shall we come on fast? Teratogenics. Yeah, these are teratogenic, obviously. If they would have taken in the any kind of the trimesters into the pregnancy, then they can cause a teratogenicity, right? Which drug keeps the patency of ductus arteriosus? Which keeps the opening of ductus arteriosus? That's your PGE1. PGE1 known to be as the alprostadil, right? PGI2, that's your prostacyclin, if you remember, right? Prostacyclin, no, not prostacyclin, that's known to be as the epoprostinol, right? That is known to be as the epoprostinol, alprostadil, epoprostinol. These are the ones which used to open the ductus arteriosus, maintains the ductus arteriosus, right? Endomethacin, it is the only NSAID, which cause the pain, which causes headache, if you remember, right? Which causes headache. Only NSAID which causes headache, that's your endomethacin. Endomethacin has also been used in the Bartter syndrome. Also used in your Bartter syndrome, right? This is the thing you have to remember, guys. Okay? Chalo, fine. Now, this is important. G protein receptors are monomeric, trimeric, tetrameric, or dimeric. Which one is it? G protein receptors. So 159 OBC, shall I prepare for NIPER? Yes, you should. Yes, you should. Satya Sumu. Sarathya Sumu. Yeah, you should. Chalo, this one. G protein receptors, monomeric, dimeric, trimeric, or tetrameric. Anyone? G protein coupled receptor known to be as the heptahelical. Heptahelical in nature. Right? Heptahelical. GPCR are of GS, GI, GO, GQ. Right? GS have the adenyl cyclase CAMP levels. GI, again, here it is increased, GI decreased, adenyl cyclase decrease. Okay, so sorry guys. Adenyl cyclase decreases the CAMP level. O decreases the calcium level. GQ, IP3, DAG pathway, calcium level increases, right? This is the thing, right? Alpha, beta, gamma are the three sites. That's your trimeric. It's going to be the correct answer. Okay. Chalo. Very good. Very good. Now, phase 2 clinical trial is also known as phase 2 clinical trials. Simple. Therapeutic confirmation or comparison, human pharmacology and safety, therapeutic exploration and dose ranging, post-marketing surveillance. Chalo, simple. Anyone? Phase 2 clinical trial. Therapeutic confirmation. That's your phase 3. Right? Human pharmacology and safety, phase 1. Therapeutic exploratory and dose ranging, that's your phase 2. That's what I asked. Post marketing surveillance, that's your phase 4. Right? Now, can you tell me after which phase do we file the NDA? We just talked about that one. After which phase you will be filing NDA? Anyone? After which phase you will be filing NDA? We have talked this one, right? That's your phase 3 only, right? That's your after phase 3 you will be filing the NDA, right? And INDA after preclinical trial, right? Preclinical trial. Okay. So first priority, first P for priority of human is safety, right? Right? First priority of human is safety. So this is the way that you can learn, right? Phase 2, okay, therapeutic exploration, phase 2 and phase 3 is where? Phase 3 is where? This one. Therapeutic confirmation. So 3, at 3 number of alphabetical order, you'll be having C, right? C comes at third position, so phase 3, right? So you have no confusion now. Therapeutic exploratory is phase 2 and C, which comes at 3, to phase 3. Post-marketing surveillance, pharmacovigilance, everybody knows about that one, right? Chalo. Here you can see, right? Also there is a one, human pharmacology and safety, maximum tolerable dose and safety is identified, and that's what they asked in GPAT 2026. GPAT 2026 may they asked this one, maximum tolerable dose and safety, GPAT 2026 they asked, right? This is the one, right? Chalo. Drug potency refers to maximum effect produced by a drug. amount of drug needed to produce desired response, speed of action, duration of action. Chalo, simple. Simple, guys. Yeah. Drug potency refers to maximum effect produced by a drug, amount of drug needed to produce a desired response, speed of action, duration of action. That's obviously going to be your B, right? Amount of drug needed to be produced a desired response. Now, suppose if a drug is showing the efficacy, analgesic efficacy at 100 mg, and another drug is showing the analgesic activity at 75 mg, then which one is potent? Tell me, which one is potent? Which one is potent, guys? Huh? Which one is potent? 100 mg, 75 mg? Tell me. 100 mg, 75 mg? That's your B, right? 75 mg more potent. Now comes along this one. Okay. So this is your dose and this is the response, right? Suppose this is the response and this is your dose, right? A drug showing this response like this and another is showing the drug response like this. This is drug A and this is drug B. Now, can you tell me which drug is more potent? Which drug is more potent? Dose is going this side and response is going this side, right? So this is the response of this one and this is the response of drug B. Now, which one is showing the more potency over here? Can anyone tell me? Which shows the higher potency and which shows the higher efficacy? Can anyone? Potency is what? Potency is associated with which one? And efficacy is associated with which one? That's what I'm asking. Are say na? I'm not saying. I'm not being able to interpret that one. That one. Which one you are saying efficacious? Which one is you are saying potent? B is more efficacious, right? And A is more potent, right? Chalo. Now we will have some more. We will have some more. This one, right? For example, this, and you have this, and you have this only. Okay, so here we do have the dose and here you have the response. Okay, A or B first, right? Second, here you have this one and here you have this one, A and B, right? Second. Now third, here you have this one and here you have this one. So A and B. Now tell me guys, which one is potent, which one is potent, and which one is efficacious? Which one is efficacious? Chalo, come on fast. A is potent. A is potent. Yeah, potent. Chalo. Which one is efficacious? See, the rule is left hand, left hand, left hand, left hand. Whichever is most onto the left hand, that will be the potent, right? Which has highest peak, that is going to be the efficacious, right? This is going to be the rule of this one, right? Chalo, see over here what is happening. And in first, you see both are having same response here also and here also, right? So both are efficacious, both are efficacious, right? But A is potent, right? A is potent. Okay. Now in second one, here you have this height and this height. So both are potent, but A is efficacious. A is efficacious. Simple. A is efficacious. And this one, if I talk about, right? So both are efficacious. Both are efficacious, and A is potent. is potent, right? Is it simple or not? They do ask question from here. That's why I made you practice over here. Is it simple or not? Simple, easy, got that in your mind? If you got that, give me a heart. Give me a heart, guys. Yeah, chalo. Okay, ekta is also here. Okay, fine, fine, fine. दिल ले लो सर, दिल मांगे मोर सर, दिल मांगे मोर, शेरशाह मूवी देखी है ना, दिल मांगे मोर. So I'm being your Sher That's what I want. है ना? चलो, दिल मांगे मोर सर. Okay, okay, guys. Okay, 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 okay. Now, Phocomelia. Arey, bachcha bachcha knows this one. Phocomelia, guys. Phocomelia is caused by quinidine, estamizole, pyridochlor, or thalidomide. NIPER JEE 2017. Simple, simple. Thank you so much, guys. Thank you, everyone. Fan of Nakul. Okay, Phocomelia is caused by the thalidomide, right? Thalidomide is very much known to you. Quinidine used as a used as an anti-arrhythmic drug. Anti-arrhythmic drug. है ना? From which class? Class 1A. I told you 1 is what? Sodium channel blocker into the open state. Yeah, that's what they asked. That's what they asked, right? That's what they asked. In open state only, quinidine, they do act, right? And first a question produce difficulty. Difficulty, right? Question means quinidine, produce means protocanamide, and difficulty means diisopyramide, right? Diisopyramide. That is what the quinidine. Astamizole is the longest and slowest acting. Yeah, longest and slowest acting H1 antihistaminic. Antihistaminic. That is what the thing is, right? Longest and slowest. Astami. Longest, right? And slowest, right? H1 antihistaminic. Okay, this is going to be the right answer. Now, okay, this one, teratogenicity table is hell important, right? You have to see this one. Chalo. Okay. Lithium exposure during pregnancy may cause cleft palate, fetal goiter, esophageal atresia, or limb detection defects. Which one is it? Which one is it? Simple. I learned this from Gautam sir. He got some 𝘂𝙋𝘼𝙎 disco stuff. Too good to remember. 𝘂𝙋𝘼𝙎 disco stuff. Nice. So lithium exposure, that's your fetal goiter. Why? Because they act as an anti-thyroid drug. They act as an anti-thyroid drug. So that's why fetal goiter will be taking place, right? Cleft palate is what? Cleft palate is associated with phenytoin, right? If you remember, phenytoin, right? Chalo. Cleft palate phenytoin or methotrexate? हाँ methotrexate. Sorry guys. नहीं इस दोनों के साथ होता है यार. Here you can see methotrexate, cleft palate, and phenytoin is also cleft palate. Yeah, that's what I think, right? This is a this is the thing you have to remember. Cleft palate, methotrexate, as well as the phenytoin. Both the things. Now, Now this one, what does Y in CYP2D6 denotes? Family, gene or gene number? CYP, Y, okay. Super gene family, which one is it? Hmm. Anyone? Anyone? Family, gene, gene number or super gene family? That's your super gene family. Very good, very good, very good. Kavishwara, very good. Welcome back. And Shraddha Wattamwar D, fan of Nagul D says D. Shivani Anand D, super gene, very good. Shravani, Mr. Bean, it's not B. Akshara, it's not B. Okay. So this is your super gene family, guys. Okay. And this is what the actual thing is, right? This is what the actual thing is, and that is also important. See, Y. Y is what? Super gene family. P is your P is nothing. 2 is your family, right? D is your subfamily. 6 is your isoenzyme, and 1 is your allylic variant. Shraddha doing double shift or what? Shraddha, who's Shraddha? Who is Shraddha? Shraddha Wattamwar. Okay, okay, okay. Okay, guys, let's go now. Affinity. Affinity is what? Bacha knows. Affinity is what? Drug binding to plasma protein. Drug binding to receptor, inhibiting potency of a drug, bioavailability of the drug. Chalo. Which one? Which one? Which one? Ah, which one? That is going to be your binding to receptor, right? That's well enough. Yep. Sure. Hana, this one is the one thing you have to remember, right? Right, right, right. Intrinsic activity. Intrinsic activity known to be as the efficacy, right? So now tell me if intrinsic activity is plus one, then it is what? Agonist, antagonist, or what? Plus one is going to be agonist, right? Affinity goes to minus one, then it is what? Then it is what then? Minus one then? Only nine people are here. Everybody got. Anyone? Minus one then? Minus one? जीरो सर फेलिसिटेशन में कितनी रैंक तक आते हैं सब आते हैं सब आते हैं मोहपात्र शुभम मोहपात्र सब आते हैं इवन इफ यू क्वालिफाई यू विल बी कमिंग देयर ओके चलो 0 to +1 is what the partial agonist right partial agonist right partial agonist and this is what known to be as the sub maximal effect sub maximal effect okay this is going to be the thing minus 1 is your inverse agonist not antagonist if it is 0 then antagonist okay if 0 then antagonist right chalo very good now which enzyme may replace protein kinase activity in some enzyme linked receptors protease guanyl cyclase lipase or epimerase चलो एग्जैक्टली मैं तो डबल आ जाऊंगी इस बार कैसे डबल आ जाओगी श्रद्धा हाँ कैसे डबल आ जाओगी मतलब नहीं समझा मैं चलो दिस वन which enzyme may replace protein kinase activity in some enzyme linked receptors that is going to be your guanyl cyclase right cgmp b को लॉक करो right चलो guanyl cyclase very good now maintenance of dose rate of drug depends primarily on maintenance dose definitely onto the definitely onto the definitely onto the total body clearance right and loading dose is acting on loading dose is dependent on which thing guys that's what I'm asking yeah Shraddha is AIR 35 GPAT 2025 sir क्या बात है लास्ट टाइम भी आई थी सर फेलिसिटेशन में, अब एक और बार फाइनल ईयर में। क्या बात है श्रद्धा यार, वेरी नाइस यार। यू हैव बीन अ इंस्पिरेशन टू ऑल ऑफ us over here, right? Very good. And how much marks you are getting this time, Shraddha? अभी कितने मार्क्स आ रहे हैं? लास्ट टाइम मैं थर्ड ईयर में थी, इस बार फाइनल ईयर में हूँ। वेरी गुड, वेरी गुड, वेरी गुड। That's your volume of distribution. Very good. Loading dose is going to be your volume of distribution, right? चलो, चलो। Ethical clearance does not required in. चलो, simple one. Ethical clearance does not required in phase 1, phase 2, phase 3 or phase 4. चलो, fine. Which one is it? Ethical clearance, this does not required in phase 1, phase 2, phase 3 or phase 4. Which one is it? That's your phase 4, right? Very good, very good, very good. Chalo, the slowest acting receptor. Slowest acting receptor. Tell me fastest acting as well. Fastest acting as well. Fastest acting as well. अच्छा, अभी एट्रोपिन साहब आ गए हैं। दोपहर में हमारे पास इंसुलिन साहब थे। एट्रोपिन इज सेइंग नाइपर फिंगर टिप्स थ्योरी अपडेट एडिशन कब आएगा? जल्द आ जाएगा बच्चे, जल्द आ जाएगा, डोंट वरी, है ना? चलो, फास्टेस्ट एक्टिंग, स्लोएस्ट एक्टिंग। स्लोएस्ट एक्टिंग इज व्हाट? न्यूक्लियर रिसेप्टर। फास्टेस्ट एक्टिंग इज व्हाट? फास्टेस्ट एक्टिंग इज व्हाट? Ion channel. Very good. Ion channel, that is also be your ligand gated ion channel, right? Ligand gated ion channel. And most present, most present, most present GPCR or not? Most present, that's your GPCR, right? Most present in your GPCR. Around 70% of the drugs binds onto the GPCR, right? Chalo. Now, it's not longest GPCR. Most prominent GPCR. Okay, Shravani? Chalo. Now, type 1 hypersensitivity reactions are mediated by. Chalo, simple. Simple. Type 1. I told you. Type 1 is what? GPCR is not fast. Fastest is ligand gated ion channel. What's your name? 𝘂𝙀𝙎𝘾𝙐𝘎𝑚OY. What's your name, by the way? Hana? Whatever you have, just write cut, and that becomes your username. Is that so? GPCR fast. That's your IgE antibodies for sure, right? IgE antibodies, anaphylactic reaction, right? IgG present in your cytolytic as well as the complex mediated, right? Type 2 and 3, right? IgM mediated is also present into the cytolytic. Macrophages, that's your T cell mediation, right? That's your T cell mediation, right? Chalo. Now, competitive inhibitor of the enzyme aromatase is, okay, so aromatase is responsible for, guys, which thing? Anyone? Aromatase is responsible for the conversion of, anyone? सर फर्स्ट टाइम आपको ज्वाइन की हम, मुझे लगा आप पूरा इंग्लिश में ही लेंगे आप, बट अब मजा फाइन, दैट्स व्हाट आई डू, नो, दैट्स व्हाट आई डू, है ना, कि आई डू make the notification for Hindi batches as well. That's why some people of Hindi do come in my session, and जब उन्हें लगे कि मैं भी हिंदी बोलता हूँ, so I'm not a one जो अंग्रेजी ही बोलता रहूंगा. That is not the thing. I am from UP itself, Shraddha. I'm not from South, right? Aromatase is your anastrozole, letrozole, as well as the exemestane, right? Exemestane, right? These are the one which inhibit the aromatase enzyme, and aromatase enzyme is responsible for the testosterone conversion into the estrogen. Testosterone into the estrogen. That what the aromatase do, right? Anastrozole, letrozole, and examatase is going to inhibit this one. So estrogen levels will be down. Okay, even ketoconazole, ketoconazole, I don't think so, ketoconazole. Chalo, fine, whatever it is. Now, this is important, guys. Enzyme, endogenous substrate, and their competitive inhibitor. That is important. They do ask question from here. Okay. चलो. Breast cancer में tamoxifen use होता है. These are not used. है ना? They can be used, but tamoxifen is the drug of choice for that one. Breast cancer में. Okay. Now, protamine sulfate is used as heparin poisoning. Is used in heparin poisoning, lead poisoning, snake venom poisoning, or arsenic poisoning. Which one is it? Protamine sulfate, guys, is your strong base. Which one is it? एंटी एंड्रोजन होता है. दैट्स राइट मिस्टर बीन, वेरी गुड. एंटी एंड्रोजन होता है कीटोकोनाजोल, है ना? दे डायरेक्टली इनहिबिट्स द सिंथेसिस ऑफ टेस्टोस्टेरोन. चलो, protamine sulfate, heparin poisoning, right? Heparin is what? The strongest organic acid in our body, in the body, right? Right? Parenteral anticoagulant. तुम लोग मिलना मुझे वहां पे, है ना? फेलिसिटेशन में मिलना जरूर. whatever whoever is coming over here, do come into the felicitation and meet me. बताना मुझे कि सर I was there in your live session, right? Ketoconazole causes gynecomastia. Very good, Shravani, very good, है ना? Heparin is your parenteral anticoagulant. Lead poisoning में which has been used? Lead poisoning में EDTA is used, right? Snake venom में arsenic में that's your dimercaprol, right? Dimercaprol. Bal is being used over there, British anti-leucide. है ना? Snake venom poisoning which is used? Heparin parenteral. Warfarin is oral. Very good, very good. Now can you tell me, guys, which is being useful into the warfarin poisoning? Which thing is being used into the warfarin poisoning? Can anyone tell me? जरूर मिलेंगे सर, अब आपकी पहचान भी होगी. बिल्कुल बिल्कुल, है ना? नियोस्टिगमिन कोबरा बाइट. वेरी गुड गाइस. नियोस्टिगमिन is being useful in cobra white, that's your snake venom poisoning. Thumbs up. चल. Now vitamin, अच्छा वो नहीं बताया तुमने. This one warfarin poisoning में which one is used? Vitamin K, right? Vitamin K is being used over there, right? To be precise, vitamin K1, that's your phyloquinone, that is your thing. Now, a route of administration that provides complete 100% bioavailability. Should I take this question? Should I take this question? 100% bioavailability, is that a question anymore? Is that a question anymore? Is that so? Intramuscular injection, intravenous injection, intradermal injection, subcutaneous injection, is that a question anymore? Jesus. Just like that, no? That's your intravenous injection, right? Intravenous injection. Is that a question anymore? Chalo, okay. Chalo, guys, okay. Now, which of the following is known to be as the extra pharmacopoeia? Extra pharmacopoeia, Martindale, but they asked in 2024. What should I do now? Chalo. Martindale extra pharmacopoeia. That's right. Martindale is itself known to be as the extra pharmacopoeia, right? Chalo. Fine. Okay. Now, sublingual route is used for दल्ले. दल्ले लिखा तुमने. दल्ले. स्नाइपर वाले दल्ले हैं. अच्छा, दल्ले नहीं, डेल है. मार्टिन डेल. I misunderstood. Sorry. Chalo. This one, sublingual, is your C, bypassing the first pass metabolism of the drug, right? Chalo. Very good. Now, intravenous drug should be acting at which angle? 45 degree, 25 degree, 10 to 15 degree, or 90 degree. Intravenous drug. Chalo. Fast. That is obviously be your 45 degree, 25 degree, 10 to 15 degree or 90 degree? Chalo, tell me guys. Hanji, anyone is there? That is your 25, right? And what is the main adverse drug reaction? Adverse drug reaction. What could be the dangerous consequence of intravenous thing? Can anyone tell me? Can anyone tell me? That's your thrombocytopenia, right? Thromboembolism. Thromboembolism can takes place. Embolism. Okay. So air entrapment into the veins, that is known as your embolism. Okay. Chalo. And this is what the thing is. You have to remember, guys. Okay. Intramuscular 90, है ना? Intradermal 10 to 15 degree. And here you have the vaccines. Lots of vaccines are being given. Thrombophlebitis, thrombocytopenia. That's right. That's right. Embolism. Right. Very good. है ना? And intravenous 25 degree. Subcutaneous 45 degree. Right. BCG vaccine is also being given through intradermal route. Right. BCG vaccine is given for the tuberculosis, TB, tuberculosis, right? That is important. Okay. Father of chemotherapy, Paul Ehrlich, Hippocrates, Galen or Ramnath Chopra. Paul Ehrlich, Hippocrates, Galen or Ramnath Chopra. Ramnath Chopra known to be as the father of Indian pharmacology, right? Pharmacology. That's a Ramnath Chopra. Galen, first pharmacist. First pharmacist. Right? Hippocrates, father of medicine. Paul Ehrlich, yes. Paul Ehrlich, also known to be as the bullet. Bullet? Bullet? What is that known to be as the bullet? Anyone can tell me? Hmm? What is that? Bullet or what? Magic bullet. Yes, very good. Magic bullet. अरे आजा भाई, मेरा पेन बुरा मान जाता है बीच बीच में, चलता नहीं है, बुरा मान जाता है. चलो, मैजिक बुलेट, वेरी गुड. चलो, select the drug that undergoes extensive first pass metabolism in the liver. Extensive first pass metabolism. वीपी सिंह इज नॉट अ पॉपुलर पीएम. वीपी पी तो यहाँ पे बहुत सारे आ गए. फेनोबार्बिटोन, प्रोपेनोलॉल, फिनाइलबटाजोल और थियोफाइलिन इज. वीपी सिंह इज नॉट टी. थियोफाइलिन नहीं, टी से कुछ और था. दैट इज नॉट द थिंग. चलो, अंडरगोज फर्स्ट पास मेटाबॉलिज्म एक्सटेंसिवली. फेनोबार्बिटोन एंजाइम इंड्यूसर. प्रोपेनोलॉल नॉन सेलेक्टिव बीटा ब्लॉकर. Phenylbutazone causes the agranulocytosis, right? Phenylbutazone, yeah, agranulocytosis. Propanolol, yeah, propanolol is the one which is known to be as the extensive first pass metabolism, right? VP Singh is not a popular premium. That's right, that's right. So all of the following drugs include microsomal enzyme except, chalo, GPRS syndrome except cimetidine, greasephulvin, rifampicin or phenobarbital. Which one is it? Which one is it, guys? Zero order kinetic, watt power, 0 watt power, phenobarbital and phenylbutazone. Very good, Shraddha. Very good. Chalo, this one. That's your cimetidine. Yes, cimetidine is the one which has the anti-androgenic effects, right? It has the anti-androgenic effect and it may cause the gynecomastia. Just like the ketoconazole, cimetidine also has the anti-androgenic effect. It can cause the gynecomastia, right? Greasephulvin is what? Greasephulvin is what? The antifungal drug. Simple. Antifungal. Rifampicin having flu-like syndrome, if you remember. Flu-like syndrome, right? Flu-like syndrome. Rifampicin, orange colored eye, है ना? That one. Chalo. Enzyme inhibitor. That's your sickface.com. Yep. Chalo. Benzofuran derivative. Yeah. Chalo. First order kinetic means. First order kinetics. F for fraction. Fraction means percentage. Fraction means percentage. Chalo. F for fraction, F for first. That is what? Constant amount of drug eliminated per unit time. That's your zero order. A constant fraction of the drug in body is eliminated per unit time. That's right. Fraction of administered dose that reaches systemic circulation. Rate of elimination is independent of the plasma concentration. No. That is going to be the P, right? First order kinetics. Very good. And this is hell important. This is hell important. First order kinetics and zero order mein difference. See, 100 mg converted into 50 mg. 50 mg, 50% gone. 50 to 25, 50% gone. 25 to 12.5, 50% gone. Percentage की बात हो रही है. We are talking about the percentage. Percentage is what? Fraction. Whereas amount, 100 mg, 80 mg, 20 mg gone. 80 to 60, 20 mg gone. 60 to 40, 20 mg gone. Right? Rate of elimination is directly dependent on the plasma concentration. If concentration was increased, the plasma rate of elimination will also be increased. Clearance is constant, whereas T half is also constant. Most of the drug follows the first order kinetics, and the drugs which follows the zero order kinetic, that's your zero what power, you know that, right? Chalo, furosemide induced hypokalemia is classified under which type of type A reaction? Okay, furosemide is what? Furosemide is what? Acting onto the sodium potassium 2 chloride co-transporter, right? Sodium potassium 2 chloride co-transporter, they're acting, and that's why they are known to be as the loop diuretic. GPAT 2026 दे के आया, रैंक गॉन. कौन सी रैंक गॉन भाई? कौन सी रैंक गॉन? ठीक है यार, कोई बात नहीं, हो जाता है कभी कभी, है ना? दैट इज व्हाट? टॉक्सिक इफेक्ट, drug withdrawal effect, side effect, or idiosyncratic effect. That's your side effect, right? Very simple. Very simple. Hypokalemia, that's your side effect, right? And which one will be causing the hyperkalemia? Can anyone tell me? Which diuretic can be causing the hyperkalemia? Which drug is causing the hyperkalemia? Ascending loop of Henle. Very good, Shravani. Ascending loop of Henle mein they will be acting, right? Descending and then ascending. Ascending loop of Henle mein they will be acting, that one, right? And furosemide is also been useful in your pulmonary edema. Pulmonary edema में drug of choice. Also, renal failure में drug of choice. Renal failure में they are drug of choice, right? So this is, you have to remember, okay? Chalo, spironolactone, very good. Potassium sparing, very good. Chalo. Unexpected drug response which cannot be predicted in individual recipients are defined as hypersensitivity, idiosyncrasy, teratogenicity, or anaphylaxis. Chalo, simple. Yeah. Hypersensitivity, idiosyncrasy, teratogenicity, or anaphylaxis. Which one is it? Cerebral edema, mannitol. Very good, Shraddha. Amrendra Kumar, hello. This is your idiosyncrasy, right? Chalo, very good, very good. All right, type 3 EDR. Type 3 EDR caused when T cells caused by tissue injury, IgG mediated caused by cytotoxic. Chalo. Do I have to tell this one? I have told you by the trick only, right? Type 3 ADR, that is known to be as the complex mediated, right? Type 3, that's your C. And C comes at complex mediated. Complex mediated. So caused when T cells bind to specific antigen, caused by tissue injury, IgG mediated, caused by cytotoxic antibody. Obviously, it's going to be your IgG antibody, right? Chalo, right? Chalo. Okay, that's what I told you, Hana. Humoral is what? 1, 2, and 3 as well, not cell mediated. Type 3 is also a humoral, right? Hypersensitivity anaphylactic, 1 comes at A. Type 2, B, blood cytolytic, and here you have the 2. 2 means 2 antibodies, IgG and IgM. Hypersensitivity 3, that's your complex antigen antibody, IgG, okay? Also, there is a thing, guys, ki these hypersensitivity reaction comes under type B adverse drug reaction, right? Type B adverse drug reaction. It is not coming into the augmented, they are coming into the bizarre kind of the adverse drug reaction, they are coming into that, okay? and that's your hypersensitivity D. D for 4 for cell mediated, that's your delayed. 4 comes at D. D as your delayed, and that's your T lymphocyte. Okay? Chalo. Now, after 4 half-life, the amount of drug is left. After 4 half-life. Chalo, come on. After 4 half-life, the amount of drug is. You have to calculate this one. Chalo, tell me, guys. Simple is it? Yeah? Chalo, guys. 21 people are left. Okay, it's more than sufficient for me. I don't want 200, 300 people in which the regular scoreboard, ticking, not scoreboard, yeah. This chat box is ticking over there, right? So that is going to be the thing. Hmm? So that's what I want. I need only some people that's whom I can talk freely, right? That's what the thing. Okay. So no option correct. Okay. 50 gone. Then 75.5 है ना plus 25 add करो. Then 87.5, right? 12.5, then 6.25. Okay. After 4 half-life. 1, 2, 3, 4. 6.25 would be the correct answer. It is written 3.25. No, hell wrong. So 6.25 is right answer, right? That is not mentioned over here, है ना? How? How? 1, 2, 3, 4. No. Mistakenly they have done this one. Mistakenly they have done the one. That was 6.25. 6.25. Okay. That's 3.25. Okay. So entry of which type of drug is most dictated by the blood-brain barrier? Simple. Blood-brain barrier have which kind of the specialized cells, guys? Specialized cells. Can anyone tell me? टाइपिंग मिस्टेक अच्छा हाँ हो जाता है कभी कभी चलो विच बैरियर हैज हाँ भाई विश्वजीत अरे क्या बात है आ गए तुम सीयूटी पीजी से यहाँ पे वेरी गुड चलो दिस वन वाटर soluble unionized volatile anesthetics or lipid soluble drugs which one is it tight junctions astrocytes as well as the pericytes, right? These are what present in your triple B, right? These are what present in your triple B. So lipid soluble drugs are allowed. Yes, sir. You may go ahead, sir. No problem, sir. Water soluble. Hey, who made you to come here? Bodyguards, let him out. Kick him out. Right? That is what? Not allowed. Unionized. Welcome, sir. Volatile. Arre. आइए sir. Volatile anesthetic. So that's a water soluble drugs. Okay. चलो. Which plasma protein? Star shaped? क्या star shaped? हाँ, that is हाँ, very good. Astrocytes are the star shaped. Very good, Shraddha. Very good. है ना? चलो. Astrocytes as well as what was that? Microglia. Microglia is also the star shaped. Okay, not only astrocytes but also the microglia. Yeah, मजा आ गया सर आज तो रोज आओ हमारी क्लास में वेलकम है आपका Which plasma protein is quantitatively the most important in the drug binding? Okay, hemoglobin, fibrinogen, albumin, or alpha 1 acidic glycoprotein albumin. Which one is it? आइए मेहरबान आइए मतलब एल्ब्यूमिन आइए आ जाइए ले जाइए है ना आइए और ले जाइए come and tick everything. That's your albumin, right? Which is going to bind with every single damn drug. That's your albumin, right? Chalo. Plasma protein binding, you know that, Hannah, and it has a correlation with volume of distribution, right? If plasma, हाँ पूछो श्रद्धा अभिषेक सर का नहीं कर रही है अटेम्प्ट पता नहीं क्या लेट इट बी उसकी मर्जी भाई जिसको करना है अटेंड वो करेगा हमारी क्लास में आएगा वो सर की क्लास में आएगा नो वरीज एटलीस्ट दे आर स्टडिंग एटलीस्ट दे आर गेटिंग सम नॉलेज दैट्स व्हाट आई से राइट सो प्लाज्मा प्रोटीन बाइंडिंग is there so volume of distribution is going to decrease right because the drug will be staying into the plasma if tissue binding if tissue binding then vd will be increased right albumin alpha acidic glycoprotein globulin lipoprotein क्या बात है क्या बात है बेड़े श्रद्धा बेड़े क्या बात है वेरी गुड tissue binding is having volume of distribution enhanced level, right? Chalo. BCG vaccine, which of the following? Root. BCG vaccine. That's what I told you. That's what I told you. At the earlier questions, I told you something. BCG questions. Chalo. PPP inverse VD. That's right. सर आप बात नहीं बनने दीजिएगा. कौन सी बात नहीं बनने दीजिएगा? विश्वजीत, फ्लर्ट नहीं करो यार यहाँ पे. Flirting is not allowed. So BCG vaccine is given which of the following? That's your intradermal, right? Intradermal is what? 10 to 15 degree Celsius or Fahrenheit? That's your degree, mainly not Celsius. चलो 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 चलो. Now, in which route the drug is administered by the choker and cannula? Shocker and cannula, guys. Pellet implantation, intravenous, dermojet or subcutaneous. बोलते नहीं है. Okay, चलो trocher or cannula. चलो. Anyone? What's your name? Cut, 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 cut. Hana, that's a huge name. What's your real name? Champ. Sir, I'm new to GDC and I'm enjoying the class. That's what the motive is, right? That's what the motive is. Are you new to GDC means you are new to this batch only. You are preparing for GPAT 2027, Shivani Anand. Hana, that's your palate implantation. That's hell right. That's hell right. So you have taken the Hindi batch or you have taken English batch, Shivani Anand. That's what I'm asking. चलो palate implantation, that's right. Okay. चलो retrobulbar roots. अरे रे रे रे, behind the eyeball. Behind the eyeball, आंख के पीछे भैंस की आंख, है ना? Behind the eyeball, भैंस की आंख. Retrobulbar, bulbar, भैंस की आंख, है ना? Buffalo eyes in English. Buffalo's eyes. Retrobulbar, behind the eyeball. That's your retrobulbar. Okay. Okay, knee joint, spinal cord, and terminus. That's your behind the eyeball only, right? Chalo. Okay. Now, pharmacokinetic is what? बहुत देर में आया भैया. Pharmacokinetic बहुत देर में आया. Sir, GPAT 2026, I have written, sir, without coaching. Okay, Shivani. Now you have taken into admission in English batch or Hindi batch. That's what I am asking. भैंस की आँख. हाँ भाई, भैंस की आँख ही है. चलो. The study of biological and therapeutic effects of drugs. Study of absorption. हाँ, यही तो है. जहां आदमी दिख जाए, जहां आदमी दिख जाए वहीं पे फार्मा है. को काइनेटिक्स है. जहां आदमी दिख जाए, वेयर यू सी आदमी, द पर्सन, काइनेटिक्स. आदमी भाग रहा है, आदमी भाग रहा है, काइनेटिक मोशन में है, काइनेटिक मोशन में है, राइट? आदमी इज इन द मोशन, दैट इज व्हाट काइनेटिक इज, राइट? कांग्रेचुलेशन शिवानी. बेटा फ्लर्ट कर ले तू विश्वजीत, बेटा सही है बेटा, तेरा हिसाब सबसे अलग में होगा. चलो, दैट इज गोइंग टू बी द थिंग. जब भी मूड फ्रेश करना है तो आपकी क्लास में आ जाता हूँ, मजा ही आ जाता है. कौन है भाई तू? नाम बता पहले भाई. शैडो एटम, किसकी शैडो है तेरी, है ना? चलो भाई. थेरापेटिक इंडेक्स ऑफ अ ड्रग इज एन इंडिकेटर ऑफ इट्स थेरापेटिक इंडेक्स. ओहो हो. टाइल इज व्हाट? टाइल इज व्हाट? सेफ्टी, राइट? सो TI इज इक्वल टू L/E, राइट? हाँ जी. That is what safety it is, right? है ना? If you increase the lethal dose, safety will be increased. Just imagine, है ना? Just imagine, that's your tile. TI is what? Safety, right? Safety, and that's your LE is. If you increase the lethal dose, LD50, safety will be increased. If you increase the ED50, then safety will be decreased. So that is inversely proportional, that one. Okay. Chalo. Shivani Anand, that's something I am asking to you. Have you taken Hindi batch or English batch? That's what I am asking to you. Chalo, guys. Chalo. LD50 refers to the which dose? Produces therapeutic effect into the 50% population. Produces no effect in 50% population. नाम सर फेलिसिटेशन में बोल रहा हूँ. अबे धोनी होनी हो क्या सर? टीवी पे देख लीजिएगा. हाँ, there is a specific class for NIPER 2006 alone. that I have to talk to them, the team, but it should be. Okay, don't worry. I will let you know. I will let you know, guys. Okay, at the end, I will be sharing my number to you guys. At the end of the class, I will be sharing my number to you. So you can text me on WhatsApp so that you can ask whatever you want to. Okay. Chalo, that is what? Lethal to 50% of the population. So guys, you want my number? You want my number? If yes, do this. I have not taken any course till now, sir. Okay, no worries. Okay. You want my number, guys? If yes, so give me a thumbs up. धंधा पानी, क्या बात है भाई, ये कौन है? धंधा पानी अनबू, कैसे कैसे विचित्र लोग हैं हमारी क्लास में. एट्रोपिन आया था, इंसुलिन आया था, धंधा पानी भी आ गया. चलो, साइनाइड पॉइजनिंग इज ट्रीटेड विद साइनाइड पॉइजनिंग साइनाइड पॉइजनिंग इज ट्रीटेड विद एक्टिवेटेड चारकोल, सोडियम नाइट्राइट और काओलिन. खाओ हमारी माता है, हमें कुछ नहीं आता है. Cyanide poisoning generally relates with the nitrates, right? Nitrates, that's your sodium nitroprusside to be precise. Sodium nitroprusside, right? Sodium nitroprusside, that's your cyanide poisoning, right? But what is being used as a treatment for that? That's your sodium nitrate, right? Sodium nitrate, ये भी गलत मार्क है. Sodium nitrate, yes, sodium nitrate. चलो, sorry, चलो. Placebos are commonly used in the clinical trial as placebo are commonly used in clinical trial as active comparator, dummy medication, standard treatment of first line therapy. कुमारिन वॉरफेरिन, yes. काओ हमारी माता है, वॉर में चली जाती है. चलो, placebo obviously that's going to be your dummy medication for control group. Okay, nice. Type B, bizarre or bichare. Adverse drug reactions are what? Predictable and dose related, unpredictable and not dose related, always due to overdose, seen only in elderly. Chalo bhai, tell me, which one is it? Type B, bizarre, unpredictable, predictable, which? Unpredictable, right? That is going to be the unpredictable. No phase in the physician is nocebo. Very good, Shravani. Good going. So this is what the thing. And also you can see like augmented. Women's do say, oh, Hana, or sit down. S for side effects, I for intolerance, and T for the toxic effect. है ना? Whenever the women see a chota bacha, they see a small kid, so they used to say like, oh, sit down, sit down. So S for side effects, I for intradermal, and T is for the toxic effect. Bizarre may you will be having the hypersensitivity reactions. All the hypersensitivity reactions that we have talked about. 1, 2, 3, and 4. Alright. How was the class, guys? That's it for today. ओके सर, प्लीज वीडियो बना दीजिए ना नाइपर की प्रेप शॉट 2 मंथ में कैसे करें स्ट्रैटर्जी. ओके, फाइन. I'll be making that one very soon. Make sure to subscribe this channel first and tell me how's the session. Chalo. Now it's time to your feedback, guys. Tell me how was the session? How was the session? Till then I can, take some sip of my Pani H2O. Fine. Okay, it's good, sir. Thank you. How we cover non-pharma portion, we'll let you know. Best explanation. So please share a number. It was nice, sir. Nice, sir. It was very informative. Nice session. Okay, thank you. Thank you. मजा ही आ गया सर. क्या बात है, तुम तो गर्दा ही बढ़ा दोगे यार. शैडो एटम. लेकिन शैडो की गर्दा कहाँ होती है. Very much informative question, sir. मजा ही आ गया. What's your GPAT? मेरी? Are you asking my GPAT rank? Don't ask. My NIPER rank? Don't ask. Okay. Very much information, sir. Looking forward to more classes. I'm looking forward to. When does revision classes start for I am prime batches? अब कौन सी प्राइम बैच की रिवीजन क्लास है भाई? जीपैट तो हो गया. GPAT is done. What kind of revision batches now? Revision for NIPER? That is for 8th April. 8th April. 18 molecular weight. What is that? 18 MW. What is that? Shraddha. Okay. Sai Krishna, nice session, sir. Thank you. Arey yaar, don't ask yet. It was good enough. It was good enough. And I make it to the NIPER as well. I have done my masters from NIPER as well. Yeah, that is what Hana I did. Chalo, don't ask them. I was NIPER में I got 238 rank. GPAT में ठीक ठीक था. GPAT में I got 595. 595 and in NIPER I got 238. Okay, चलो. Water sir. 18 molecule 18 milli water. अच्छा जो भी था पता नहीं यार. H2O. Sir, firstly मेरा bottle please check one cyanide poisoning question then tell about non cover pharma. देखता हूँ. अच्छा वो cyanide वाला. देखता हूँ. Okay. So tell about cover non. We'll tell you know about this one, right? We'll tell you about the non pharma. Okay, don't worry. Okay, so my number. Text me right now, just after the class. Right now, text me with your name so that I can save your number too. And make sure you text me right now. Otherwise, I will be थोड़ा सा गजनी type का person. I will be, you know, figuring out the things कि क्या हुआ था, कौन आया, किससे बात हो रही है. That is the one thing, and you should text me right now so that I can have that in my mind because मेरी गजनी वाली चीजें हैं. 15 minutes में all the things I gone. That's what I think. Okay, so this is what the name, and you should be knowing my name. Knowing my name is Devanshu. Wow, I would be expecting this one. Very good. Students are asking my name. Very good. YouTube पे देख लीजिएगा श्रद्धा. YouTube पे you can. चलो name sir. All right, guys. Okay. Thank you so much for joining. And that's it for this session. I will be right back very soon for you guys. And have a good sleep now. Do take care of yourself and be a better version of yourself day by day. Damn day. Thank you so much, guys. And I hope you would have liked the session. Do comment. Do comment. Not into the live chat. वीडियो खत्म होने के बाद में कमेंट करना रियल वाले पे. ठीक है, थोड़ा सा मुझे भी अच्छा लगेगा जब मैं बाद में देखूंगा तो. ओके, डू कमेंट इनटू द रियल वाला कमेंट सेक्शन, राइट, नॉट इनटू दिस वन. दिस इज ऑलरेडी फेक. आई ओनली बिलीव इन जस्सी भाई. ओ, आई ओनली बिलीव इन दैट कमेंट सेक्शन. ओके, चलो, थैंक यू सो मच गाइस एंड विल बी मूविंग अहेड. बाय बाय, साइनिंग ऑफ.